Welcome. For those who are interested in learning more about heart sounds, I'm going to share some beginning basics with easy tips and tricks that will help you remember what you need to know before you can dive into the specific types of heart murmurs. It's important to have a good stethoscope that comprises of a bell and a diaphragm. The diaphragm is most effective at transmitting the higher frequency, the high-pitched sounds like S1 and S2. The bell is most commonly used for transmitting lower frequency and low-pitched sounds. When you use the diaphragm, it should be pressed very firmly against the chest or wherever you are listening. The bell, however, is placed only very lightly because that is how you hear the lower pitched sounds like S3 and S4. A beginning basic you should understand is the actual blood flow through the heart. The blood will begin in the right and left atrium. When that fills, the valves will open and the blood will rush down into the left and right ventricle. The ventricle will squeeze during systole and push the blood out of the heart through the pulmonary artery and the aorta. Blood will return to the heart through the pulmonary vein from the left, the inferior and superior vena cava from the right. By understanding how the blood flows through the heart, you will have a better understanding of what valves are open during different stages of the cardiac cycle. Once you know how the blood flows, it's important to know where the valves are in the heart and what they're called. The tricuspid valve is located between the right atria and ventricle. The bicuspid valve, or mitral valve as it is commonly called, is between the left atrium and ventricle. The aortic valve takes off from the workhorse of the heart, the left ventricle, and the pulmonary valve takes off of the right ventricle and pushes the blood into the lungs. I thought this was a great video of a see-through heart where you can actually see the different valves as they open and close during the cardiac cycle. The AV valves, or atrioventricular valves, include the tricuspid and the bicuspid, or mitral valve. The tricuspid valve has 3 cusps, therefore called tricuspid, while the left AV valve has 2 cusps and is known as the bicuspid or mitral valve. And the word mitral is noted because it is said to resemble a bishop's mitre. Now, how can you remember where these valves are located? The tricuspid valve on the right has 3 cusps. The bicuspid valve on the left has 2. In the same nature, when you talk about the lobes of your lung, there are 3 lobes on the right and only 2 on the left. Therefore, visualizing yourself wearing a 32 football shirt, you're able to remember that there's 3 on the right and 2 on the left. Remember, you are wearing the number 32 shirt. Therefore, tricuspid 3 is on the right, bicuspid valve is on the left. When listening to heart sounds, you need to know where to listen to hear the different valves at their highest intensity. The aortic valve can be best heard in the second intercostal space to the right of the sternum, also called the right upper sternal border. The pulmonic valve can be heard at the second intercostal space to the left of the sternum, also called the left upper sternal border. The tricuspid valve can best be heard at the fourth intercostal space to the right of the sternum, also called the right lower sternal border. And the mitral valve can best be heard in the fifth intercostal space on a mid-clavicular line. Now you'll notice that the aortic and pulmonic areas are the opposite of where the valves are actually located. That is because when the aortic valve on the left ejects, it is angled towards the right, and therefore you can hear that best on the right sternal border. Conversely, the pulmonic valve, which is on the right side of the heart, ejects towards the left and therefore is best heard on the left upper sternal border. An easy way to remember this is the mnemonic, all physicians take money. So going across your chest, aortic, pulmonic, tricuspid, mitral, all physicians take money. When listening to heart sounds, we have S1 and S2, the lub-dub. If you have a difficulty determining which one is S1, put your stethoscope on the chest and palpate the carotid artery at the same time. The carotid pulsation will be felt just prior to the S1 or lub of the lub-dub. The actual heart sounds you are hearing when you listen is the sound of the valve cusps snapping shut within the heart. The first heart sound, or S1, the lub of the lub-dub, it occurs when the atrioventricular valves close. This is S1. It occurs at the end of diastole. The tricuspid and mitral valves are closing. They are called atrioventricular valves because they occur between the atrium and the ventricle. The second heart sound, the dub of the lub-dub, occurs when the semilunar valves, or the aortic and pulmonic valves, close. This is at the end of systole. And the semilunar valves, they get their name from the crescent moon shape of the flaps that make up that valve. Another beginning basic to know is that there are two types of murmurs generally. When you're listening, you can hear these heart sounds depending on where you're listening, and they can be either stenotic or regurgitant, and another word for regurgitant is insufficient. With a stenotic valve, think of a stiff valve, and you're going to hear this when the valves are opening. With a regurgitant or insufficient valve, think of a leaky valve, and you're going to hear this when the valves are closed. For example, aortic stenosis, you hear that when the valve opens because the valve is stiff and hard to open. And for the murmur of aortic regurgitation, the valve will be closing, and because it is leaking and not fully closed. Therefore, this will apply to all the valves in the heart, whether they're opened or closed, and leaking or just stiff. Mitral regurg, mitral stenosis, tricuspid regurg, pulmonary insufficiency. These are all murmurs you may hear. Not so common would be the pulmonary stenosis or tricuspid stenosis, but it's possible. You need to know when each valve is open or closed during the cardiac cycle so that you know when you're listening to determine what type of murmur you are hearing. We're going to discuss a cool trick to remember which valves are open during the cardiac cycle on the next slide. When you are listening to murmurs, it is good to know if the valve in the heart is open or closed according to where you hear it. The bucket visualization is a great way of visualizing what valves are going to be open and closed during the systole and diastole. For systole, pretend you are squeezing the bottom of the heart, S1, the lub part of lub-dub. When you squeeze the bottom of the heart, you can see that the aortic and pulmonic valves are on top. Therefore, squeezing the bottom, the blood is going to eject through the aortic and pulmonic artery. That means they are open during systole. So if they are open, that means the tricuspid and the mitral must be closed. Now, open your hand like you're filling a bucket. That is diastole. The ventricles are filling. Therefore, if the ventricles are filling, the top valves must be closed, the aortic and the pulmonic, and the inside valves, the tricuspid and the mitral, are open. To help you visualize this, hold your hand open and squeeze it. Once you squeeze it, say lub, and when you open it, say dub. So during the squeeze with lub, you're squeezing the bottom chambers of the heart so the upper valves are open. Blood is going out through the heart through the aortic and pulmonic valves. Therefore, they are open and the inside valves are closed. During diastole, when you open your hand, you're filling your bucket to show the blood is flowing down inside the heart. It's going into the ventricles. Therefore, the mitral and tricuspid valves are open. The aortic and pulmonic valves are closed. The video will show how I visualize the bucket. Stop now and do this a few times, visualizing the blood flow and the valves that are open during each part of the cardiac cycle. Here's a quick review. You're seeing the 4 valves of the heart. The tricuspid and the mitral valve are closed. The pulmonic and the aortic valve are open. Is this systole or is this diastole? You're right, systole. The aortic and pulmonic valves are open. Therefore, the ventricles are being squeezed. And this is systole, S1, or the lub part of lub-dub. Another easy way to remember if certain murmurs are systolic or diastolic murmurs would be to remember Mr. Pass and Ms. Ard. Mr. Pass is a systolic murmurs. MR, mitral regurg. MVP, mitral valve prolapse. AS, aortic stenosis. Those are all systolic murmurs. The diastolic murmurs are Miss Ard, MS, mitral stenosis, and AR, aortic regurg. One last final thing you should know about basic murmurs is that the common descriptive terms used for these murmurs include rumbling, blowing, machinery-like, scratchy, harsh, or musical. And the different murmurs are graded according to the Levine scale. A grade 1 murmur is very faint, very hard to hear even by experts. Grade 2, you can hear that. Usually it's a pretty good, that's the stage that most people can catch the murmurs at. Grade 3, easily audible, no thrill. A thrill is the palpable vibration. You could actually put your fingers on the heart and you can feel the turbulent blood flow through that valve. Grade 4 is a loud murmur and you can actually feel the thrill. Grade 5, very loud. Usually you hear it over a wide area and it has the thrill as well. Grade 6, extremely loud, and you could almost hear this, and many times do hear this, without a stethoscope. With this basic review of heart sounds, I am not going over the specific types of murmurs and what they sound like. However, there are many sites online where you can Google these murmurs and hear what they actually sound like. The Auscultation Assistant link is here, as well as the University of Washington Department of Medicine. They have wonderful links where you can hear the different types of specific murmurs. YouTube as well has many more videos where you can hear the different heart sounds and murmurs, more than what I want to go into here. So I hope you have enjoyed this review of the beginning basics of heart sounds. We have reviewed how to use the bell and the diaphragm on the stethoscope, the basic blood flow through the heart, where the valves are located with our 32 football jersey, where to listen to them best using the All Physicians Take Money auscultatory areas, how to find S1 or the lub of lub-dub using the carotid pulsation, the two basic types of murmurs including stenosis and insufficiency or regurgitant, when the valves are open or closed during the cardiac cycle to determine if they are diastolic or systolic murmurs, and how to grade the sounds that you may hear. Please check out our other training on the YouTube presentations we have at mycaregivercoach.com, which we are happy to offer at no cost. If you hit subscribe, you will receive updates to any new content that we will be adding. Thank you for listening.